Nerve damage is a condition that can occur due to various factors such as injuries, illnesses, or certain medical conditions. It can have a significant impact on a person's quality of life, affecting their mobility, sensation, and overall well-being. While nerve damage can be complex and challenging to treat, there are several factors that play a crucial role in its management and potential repair, including nutrition, and the intricate connection between nutrition and the vagus nerve. The vagus nerve, also known as the 10th cranial nerve, is one of the longest nerves in the human body. It originates in the brainstem and travels down the neck, chest, and abdomen, reaching various organs and body systems. The vagus nerve plays a vital role in regulating many bodily functions, including digestion, heart rate, and inflammation response. It is also responsible for transmitting sensory information from organs to the brain and vice versa. Nutrition plays a significant role in supporting the health and function of the vagus nerve and overall nerve health. The vagus nerve relies on specific nutrients to maintain its integrity and optimal function. Essential nutrients such as vitamins B6, B12, and folate are crucial for nerve health and the production of myelin, a protective sheath around nerve fibers. Omega-3 fatty acids, found in fish, flax seeds, and walnuts, have anti-inflammatory properties that can benefit nerve health as well. In cases of nerve injury or damage, nutrition becomes even more important for the process of nerve repair and regeneration. The body requires adequate amounts of protein, which supplies the necessary amino acids for building and repairing damaged nerve tissue. Additionally, antioxidants found in fruits and vegetables, such as vitamin C, vitamin E, and beta-carotene, can help reduce inflammation and oxidative stress, both of which can impede nerve healing. When facing nerve damage or seeking treatment options, it is essential to consult with a specialized healthcare professional, such as a nerve doctor or neurologist. These experts have the knowledge and expertise to diagnose and develop personalized treatment plans tailored to the specific condition and needs of each individual. They can conduct tests and evaluations to assess nerve function, prescribe medications if necessary, and provide guidance on incorporating nutrition and lifestyle changes to support nerve repair and reduce pain. Nutrition facts and understanding the impact of food choices on nerve health can empower individuals to make informed decisions regarding their diet. Consuming a well-balanced diet that includes a variety of nutrient-dense foods is key. Incorporating foods rich in vitamins, minerals, antioxidants, and healthy fats can promote nerve healing and alleviate symptoms associated with nerve damage. Certain foods have been recognized for their potential benefits in nerve repair. For example, foods high in vitamin B12, such as shellfish, fortified cereals, and nutritional yeast, can support the regeneration of nerve cells. Additionally, foods rich in magnesium, such as leafy green vegetables, nuts, and whole grains, may help reduce nerve pain and support nerve function. It's worth noting that while nutrition can play a supportive role in nerve repair and overall health, it should not be seen as a standalone treatment for serious nerve injuries or conditions. However, incorporating nutrition tips and making dietary changes can be a complementary approach to other treatments prescribed by healthcare professionals. In cases where nerve pain is a predominant symptom, techniques to treat nerve pain without medications can be explored. These may include physical therapy, acupuncture, transcutaneous electrical nerve stimulation, and relaxation techniques such as meditation or deep breathing exercises. These methods can help manage pain and improve overall well-being without relying solely on medications. Supplementation may also be considered in certain cases of nerve injuries or damage. Specific supplements, such as alpha-lipoic acid, acetyl L-carnitine, and vitamin B complex, have been studied for their potential benefits in supporting nerve health and regeneration. However, it is crucial to consult with a healthcare professional before starting any supplementation regimen to ensure safety and effectiveness. Lastly, the emerging field of nutritional psychiatry explores the intricate connection between nutrition and mental health. Although it may not directly address nerve injuries, it highlights the significance of nutrition in maintaining overall well-being. A healthy diet rich in essential nutrients can positively impact mood, cognitive function, and overall mental health, indirectly contributing to the management of nerve-related conditions. In conclusion, nerve damage is a complex condition that can significantly impact a person's well-being. While nutrition cannot reverse severe nerve injuries on its own, it plays a crucial role in supporting nerve health, repair, and overall well-being. Understanding the link between nutrition and the vagus nerve, consulting with specialized healthcare professionals, making informed food choices, and considering complementary approaches can all contribute to managing nerve damage and promoting the best possible outcome for nerve repair.